Back, joint pain, stiffness, and swelling are the most common types of symptoms of arthritis. I had the chance to sit down with a specialist from Advanced Pain Care to learn a little bit more about how it all works. Take a look at this. We are so glad this morning to be joined by Dr. Samuel Pegram. How are you doing, doctor?
I'm doing fine. This social distancing issue is a little bit awkward, but otherwise I'm doing great.
I think awkward encapsulates it pretty well, but thankfully you're still able to practice and you're still able to offer people some good care. So let's talk first and foremost about arthritis today. What are some common treatments that people would use for arthritis?
Yeah, there's so many forms of arthritis, from simple things that patients are familiar with, like gout or the arthritis of time, degenerative joint disease, and then there are these more advanced and aggressive forms of rheumatism like rheumatoid or lupus. So the treatment varies. It's simple things like anti-inflammatory agents, low-dose steroids, orally or injectable for things like gout, intra-articular injections for patients who have the arthritis of time. And then for diseases like rheumatoid or lupus, we've got much more sophisticated therapy. Some forms of chemotherapeutic agents, and then most importantly, the biologic agents that all of us see on television every 5 minutes now. Those drugs have made a remarkable advancement in the ability to prevent crippling in patients who have inflammatory forms of arthritis.
Well, it's good to know that some of those drug commercials are worth it. Okay, let's talk about some of the conditions that you treat.
Most commonly, we see the arthritis of time, which all of us would hope we could avoid, but we can't. That's osteoarthritis. And as I mentioned, more system-wide and diffuse forms of arthritis. Rheumatoid is sort of the sine qua non of those, which can be a much more crippling form of rheumatism. Lupus is a system-wide disease that affects not only the joints, but internal organs such as the lung, such as the central nervous system, and particularly the kidney. And then I also see vasculitic issues, which are inflammatory conditions of small blood vessels. And when those blood vessels are affected, no blood flow to the organ, and that organ suffers. Rheumatologists have to be attuned to the fact that their diseases can affect a number of different organ systems.
Wow.
So putting hands on people is still something that doctors do.
You also wanted to talk about some of the goals of what you're trying to do as a rheumatologist. So some of the goals of therapy, for example.
Yes, one of the primary, in fact, our primary goal as a rheumatologist is to make an accurate and an early diagnosis. The reason that's so important is our primary goal is to never allow crippling to occur at any joint space. And we have the best opportunity to do that if we make a diagnosis early in the course of the illness, as well as an accurate diagnosis, because we have all of these wonderful new medicines now for the treatment of arthritis, and we can bring the full force of those new medicines to bear on that patient's particular illness. And if we do it, again, accurately for the right diagnosis, we've got a wonderful opportunity to not only prevent progression, but in some patients, we can even get remission.
And let's talk about how things are changing right now. How soon can a patient get in to see you to get some of your expertise?
There's no greater discussion, I think, that we have in medicine today than access to health care. And one of the things that Advanced Pain Care Rheumatology has done is that they decided that we needed to improve that. So one of the things they did is to bring more rheumatologists on board, which is why you're talking to me. In addition, we've got mid-levels to help us to see some of our patients and follow-up so we can bring new patients in. And our philosophy is that if physicians send us patients and they've got acute issues, such as hot swollen knee, they've got a bursal area that needs to be injected, we stay a little late, we come in a little earlier so that we can take care of those patients. So our patients see us not in months like it's generally here in Austin, but in days or weeks.
To touch again on your philosophy of care, you talked about how you're a little different than people who, for example, focus on surgery or something like that. Yes. What's your approach for patients?
We want to get to know the patient. We know that handshakes and smiles still go a long way. We also understand that, again, our focus is making that diagnosis. And if we make that diagnosis accurately, we can bring all of the necessary tools to that patient in one place. That's why Advanced Pain Care has brought in the expertise of orthopedists, neurosurgeons. We've got people who deal with behavioral health all under one roof. So we can get all of those things to the patient early in the course of their illness. And so with all of those things available, why would you want to go anyplace else?
That's pretty incredible. Comprehensive care. Dr. Pegram, thank you so much for spending time with us today. We appreciate it.
It's my pleasure. Thank you.
You can call Advanced Pain Care at 512-244-4272 or go online, austinpaindoctor.com, for even more details.